Good morning and welcome to Pinpoint for Health webinar, Bouncing Back from Bad Publicity. Do not be fooled. This is not Jackie Russo. This is actually Gina Aswell. Jackie couldn't be with us today, so I'm filling in for her. I am a senior brand strategist at Russo and happy to be with everyone from Pinpoint for Health today. So bouncing back from bad publicity, it can happen to anyone, whether you have a clinic, some sort of nonprofit support agency in healthcare, or a larger health system. Everyone is vulnerable and can experience bad publicity, but people think it will never happen to them. So look, it's easy to get distracted and lose focus of your mission, whether it's experiencing growth and getting caught up in that's really what affects most people, or it's putting out fires for the day-to-day and not being prepared for those challenges. And employees, as you're hiring employees, as you grow, sometimes they're not being properly trained, or it's your high-ranking executives who've lost focus. With the proliferation of social media and rapid changes in technology, in general, more is being added to your plate, so much so that you forget what you're facing each day and what your actual mission and goal is. So that's kind of something that you really need to keep in mind. The important thing is to recognize when something happens that you actually have gotten off track, but how do you fix it? And speaking of getting off track, I want to let you know that I'm going to get you in and out of here in no more than 30 minutes. And we also send recordings after the fact. So if you have to hop off, don't worry. We'll send you a recording of this webinar. And if you want to see previous webinars, please go to our webinar page at pinpoint-for-health.org. And also, if you look on the right side of your screen, we have a chat feature which you can ask any questions during this webinar, or you can email me after Gina, Gina, at brandrusso.com, or you can email Jackie, which it's already tied into this webinar, and she'll be happy to answer any questions as well. So getting back on track, bad publicity, it can throw you off of your groove and it can shed a less than flattering light on your organization. Within or outside, it's all about how you respond. You have to be honest and transparent, and something as simple as an online review to quarterly losses can really throw you off your game. If you are honest, it will definitely earn you some respect, and it gives you a chance to address the problem head on and to move on from there. This could be anything from a bad review to a very public firing of an employee to a widespread medical disaster that involves you. If it's the employee situation and they make the firing public, well, you can't really respond probably in the way that you would want to, but you have to go ahead and address it by talking to your HR department and finding the most tactful and appropriate response to maybe not combat the situation, but to give as much information as you can as possible. Sometimes you have to get legal involved. Another issue can be a medical disaster, everything from Ebola or to a mass shooting. We had an example of a shooting over here in Lafayette, and it was pretty recently. We had two different hospitals that were taking care of the injured people, and it was really interesting. One hospital, a part of town, they had a really large contingency of people, and they gave regular updates. They, of course, it all followed protocol and all the regulations that you have to follow, which are many, of course. But they gave regular updates to the press. The community felt like they were well informed. They didn't speculate on anything, of course, but simply saying, we have so many injured, this many in critical condition. And then as those statuses changed, then they also changed their updates. They held press conferences, and they were very open and very quick to respond to the media. On the other hand, there was another hospital across town who was handling some of the patients, and they basically ignored all requests from media. They they really did a poor job of responding just in general to the community. And one of the things you don't want to do is tick off the media. And so they really got a bad rap for that. The first hospital didn't violate any laws. They did what they needed to do, and they started to gain the trust and respect of the community. And that is priceless. So really, whether it's a train derailment, a massive auto accident, you must be ready to respond. Um, so whatever you're dealing with, really, whether it's big or small, it's important that you address the issue head on as soon as humanly possible. Making sure your people have the facts straight, that is absolutely key. There are too many ways that wrong information can be spread. And if you are out there in the forefront, you can rein in any of those rumors and you're directing the conversation. And I think that's the most important thing. You go back to being honest and transparent, that's important as well. But you have to inform them and make sure they have the correct information. You have all of these audiences, from your staff to your patients to the patients' families, your administration and different stakeholders, and your media. Media, they're your people too, and they're not your enemy. You need everybody to be on your side and very well informed. They have to be on the same page. And when it comes to your people, especially within your marketing departments, or maybe you have a smaller situation, so that marketing department is one person, you have to make sure they go through message training. You have to set that message. You have to test them, maybe create a faux emergency for your staff and practice. It's so important. And, if they're on the same page, it makes your agency or organization look like it's more buttoned up. So let's say bad publicity happens. Correcting your brand is doable if you keep these 5 key elements in mind. Write a plan. If you come away with anything from this webinar, make sure it's this. Put together a plan. Make sure your staff is well versed in your protocol. And most importantly, stick to it. Without a crisis communication and plan in place, things start to fall apart very quickly. And the last thing you need is someone throwing gas on a fire when the goal is to put out the fire as quickly as possible. It's just one of those situations where your writing of a plan, it really can be as simple as establishing lines of communication, both internally and externally. Who needs to know what when? Who is that key person? Maybe it's not your executive who's responding. Maybe it's somebody 4 levels down. What are they supposed to say? Do they have the training to say that? And if you have a plan in front of you and in front of them, then it's easier. Who's responsible for speaking with the media? Who should not talk to the media? Who will be deciding the voice of whatever position your company decided to take? Having these basic elements in place can really prevent any missteps and keep everyone on the same page when it's needed most. Going back to our hospital example, it was very clear that one of the CEOs took the spotlight, especially in this case of this mass shooting. And they were well presented, they were well trained, they knew exactly what they needed to say without violating any laws or regulations. Second, be honest, never say no comment. I know that's something that people say a lot, never say no comment, but it's so true. It's so important to be as transparent as possible. And it really is the only way to maintain a level of trust with your advocates and the media. If you're not upfront, the information will come out eventually. And this can lead to a complete breakdown, not only with your primary audience, but those that learn of things secondhand. Never let caution come off as stalling. That's one of the worst. That's why, going back to key number 1, writing a plan, it prevents that stalling. For hospitals, it's really easy to be hesitant due to all the regulations that you have to follow. But be sure to never let caution come off as stalling. In these instances, you have to follow your plan, be specific about when you will have a statement ready, and problems generally arise with you instead decide to go silent while you figure out everything. And That's when the problems really come in, is when you really don't say anything and you don't have a voice. Because then you're now not navigating the conversation. Fix the problem. That's, probably up there with number one. Whatever challenge is thrown your way, it's important that you do everything you can to correct whatever went wrong and leading to the negative publicity, not just, through words, but actual actions. A lot of times, let's say it's a bad review. Let's take out the shooting example and do something as simple as a bad review. Maybe it's through health grades and maybe you're a doctor's office. It's important to reach out to those people, respond, see if you can contact them, see whatever issue that happened to them, whether, maybe someone was rude to them. I mean, it can be as simple as that. Figure out a way that you can solve that problem by saying, look, we're training our employees, we're putting a system in place. Maybe it's, training of customer service, whatever it might be to help that problem be fixed. Let people know that you're fixing it. But with that being said, be sure not to let the circumstance dictate those actions. Yes, you want to demonstrate forward momentum, but you also don't want to make like wide sweeping changes without thinking everything through and just saying, oh, this happened, we must start over with a clean slate. By simply stating that you are working to address whatever issues brought on the current situation, you let your internal and external audiences know that you're dealing with the thing in a proactive manner. This will help build back the trust without overcommitting to things you may not be able to deliver upon. And it's all about being able to deliver. Your promise is your brand. And if you do not deliver on that promise, then you lose that trust and you lose your advocates. So it's very important to fix the problem, but be true to who you are at the same time. All right, issue a statement immediately with regular updates. We kind of addressed this a little bit earlier. No matter how hard you try, wish, or pray, the problem does not suddenly disappear. So the best thing to do is really just bite the bullet and address the issue head on. A plan will help you avoid any procrastination, of course, and save you from possibly being the one left holding the shortest straw. It's really important that you really respond to an issue. If you pretend like it doesn't exist, then again, you don't have a seat at the table, and then you're missing out on continuing to build that trust. Once you've issued a statement and have begun fixing the problem, it's important to be consistent with regular updates. This will maintain a level of trust even during a crisis, which in turn, it makes your brand stronger. And last but not least, maintaining goodwill. You have to create and maintain goodwill. One would hope that your organization would be a proponent for community engagement before a bad publicity ever hits. If that's the case, you've already built a relationship with your community that will help you through any turbulent time. Whatever it might be that you can participate in, whether it's encouraging your employees to participate in some sort of nonprofit volunteer work, or if you're partnering with another organization, or there's some sort of sponsorships involved, whatever it is that you can do to make sure that your name is out in the community, especially the person who's going to be your key speaker whenever it comes to your media. Whoever's out there in the media and really your spokesperson, it's important that the whole public are really familiar with them, especially, your publics that are around, from those that I talked about before, your staff, your patients, all of your internal audiences, from your stakeholders to administration, all the way through to the people in the community, because they're part of your audience as well. In addition to your target audiences that, you're really trying to grab those patients. So that's really important. And you have to remember that people are willing to forgive someone if they know you, particularly when they have a vested interest in their outcome. They really like to know people. You know it. You do business with the people that you like and can associate with and have a relationship with. And if they're involved with you and they see, even if they see that you're engaged in the community, It's really important because they'll see that you have a face, you have a name, and they can trust you, and then they'll forgive you if something goes wrong. So a little summary. I know we're a little quick today, but the worst thing you can ever do is to believe you are safe from anything ever happening. And unfortunately, it happens when you least expect it. But if you have a plan and you're prepared and you can avoid turning a small fire into a raging inferno, and for the larger issues, you can help salvage your reputation and obviously save your brand. If you have any questions, I'm really happy to answer those right now. Of course, you can use the chat feature on the right-hand side, and I'll be happy to answer any of those questions, or you can simply email me, Gina@brandrusso.com, and here's a slide for that. If you want to know more about Pinpoint for Health, please go to pinpointforhealth.org. We have some really great information in there besides just webinars. We also have some wonderful blogs. It's something that's educational. It really focuses on developing brands specifically for nonprofit healthcare organizations, but really can apply to all healthcare organizations. And if you have any questions, please feel free to pipe in right now. And if not, I hope to see you soon. Also, you can go ahead and listen to a replay of this webinar anytime by going to our website and going to pinpointforhealth.org and clicking on the webinars. All right, looks like we don't have any questions. I hope you have a fabulous day.